Hi, Deborah. Thank you for coming in today.
Well, thank you for having me come in to interview.
So you applied for the pharmacy technician 2 position with our hospital.
Yep, I applied online.
Why are you interested in this job?
Well, I've been looking at getting back into the pharmacy setting, and a friend of mine who works here mentioned that I should apply. And I've also missed working with and helping patients and staff with medications.
Do you work well under pressure?
Yes, I feel I work well under pressure. I'm used to having to prepare meds stat for the ER or ICU. I have had a long history of working in customer service oriented jobs and have learned that patience and listening are invaluable.
Describe a time when you had an upset customer and how did you handle that?
So, one that comes to mind is a time when a patient came up to get a refill for their medication, and it showed that there was a higher copay amount than what they were used to paying. She was very upset and did not want to pay that high of a price. She wanted to know why it cost so much. I told her that if she would have a seat, I'll go ahead and give her insurance company a call and see what happened. Um, it turned out that the generics tier level had changed her insurance, and that medication is at a different um, tier level. So I was at like a high. There's tier 1, 2, and 3, and this one was on a higher tier level. So her copay was a little bit higher than what she was used to paying. We were able to switch her medication to a different generic so that it was covered at the lower tier level, so a lower copay. She was very happy and thanked me for taking the time to help her.
How does your previous experience benefit this role?
Well, I've got 12 years experience working in the pharmacy industry. I've worked with compounding IVs and chemotherapy medications in a hospital environment. I understand the need to work quickly yet accurately in an emergency situation. And I'm a team player, but I can also work independently.
What are your career goals?
Um, let's see. Well, I was looking at returning to the pharmacy as a technician, working with compounding medications and IVs in the hospital setting. In the long term, I'd like to pursue a lead technician role and continue to grow with the company that I'm working for.
How would your coworkers describe you?
They would say that I'm friendly, um, always on time, and willing to help out. Um, Always ask questions when I have concerns going on, but I'm also a person that can help if they have a question, like with training or just to kind of hash things out to see how things are going. Um, yeah, that's about it.
Okay, do you have any questions for me?
Yeah, actually, what is the training like for this position?
Well, on the first day of training, we give you a tour of the facility and you will meet with one of our senior pharmacy techs. They will then go over the training for the week and introduce you to the rest of the staff.
Okay, that sounds good.
So do you have any other questions for me?
Nope, I think that's about does it.
Okay, well, thank you for coming in today. We will be making our decision by the end of the week. And we'll let you know either way.
Okay, well, thanks for having me. It was a pleasure to meet you, and I look forward to hearing from you soon. Thanks. Bye bye.